Hi, I'm Dr. Jan Jaffer, and this is Got Teeth, a patient-centric monthly podcast featuring local health experts. So today we have Katie, who's the Executive Director of Safelink, and Awashan, who's also a Community Relations Manager with Safelink. So thanks for joining us today, guys.
Thank you. Thanks for having us.
So I don't honestly know that much about Safelink, and I'm sure there's a lot of people in Calgary and Alberta that don't actually know a lot about Safelink. So start out by just telling us the basics. What does Safelink do, and how does it help the communities of Alberta?
Yeah. So we've been around since 1983, but we've had a number of name iterations, which is probably some of the confusion in the community, unfortunately, too, around who we are and what we do. So in 1983, many people knew us as AIDS Calgary. And we worked primarily with folks that were dealing with HIV and AIDS based on the epidemic that was happening in the 80s and 90s especially. And things evolved and changed a lot when it comes to HIV testing and treatment for HIV. The treatment options are much better now, and HIV is quite a bit more manageable when you're on treatment. So our work transition to more of a prevention and education and targeting populations that were disproportionately affected by HIV and other sexually transmitted and bloodborne infections like hepatitis C, and syphilis is actually making a real big comeback in Alberta right now. So that's another target area for us. And the communities are often those that might be impacted by systemic trauma, systemic challenges and issues over the years, such as Indigenous communities, African, Caribbean, and Black communities as well are a priority population for us. We have a lot of newcomers, and they might be from an HIV endemic country in Africa or in South America. There are some HIV endemic countries as well. We also do a lot of work with folks that are just more potentially at risk of contracting HIV or hepatitis C or other sexually transmitted and bloodborne infections. So folks that may be engaged in sex work, folks that may be using substances, and we also work a lot with the queer community. So we have a number of priority populations, and the work with the queer community has been very long-standing. From the get-go, when HIV was really prevalent and was much more of an endemic in our city, the queer community has been our community that has rallied and really supported the work that we do and taken care of a lot of folks in especially the 80s and 90s that were unfortunately dying of HIV and then AIDS. So yeah, that's a bit about kind of who we are, our history, and what we do. We also had the name HIV Community Link for about a decade. So we went from AIDS Calgary to HIV Community Link, and now we're Safelink Alberta because our work has changed and our priority populations have expanded. Doing much more on the prevention side of things, it's opened up who our priority populations are. And we felt that removing the word AIDS and or HIV from our title was making the work that we do just more inclusive and reflective of our key populations.
Well, no, that's amazing, because obviously we're moving, and I think that's just what society is. We're moving away from, again, we're getting into prevention, right? We're moving away from just treating the disease and trying to, prevent the disease from happening, which I think is important across healthcare generally, not just in the areas that you guys are working on. Is if we can prevent disease, the population as a whole becomes much healthier, and then we can help deal with them. So how do people find you? What is the best way that people can get in touch with you, or how do you reach out to the communities that are affected or challenged by this?
Yeah, we have a number of different ways based on the different populations that we have. So we try really hard to be where the community is at. So for example, for people who are using substances, especially who are perhaps injecting substances, we have a drop-in space. So we will encourage people to come and drop into our space anytime Monday to Friday between 1 and 4. And they can receive safer supplies, and they can receive education around safer substance use to try and reduce any risks associated with using substances. With the African, Caribbean, and Black communities and with Indigenous communities, we take a bit more of a being in the community and meeting them where they're at. So whether it's at different community events that might be more culturally specific, and also coming to the events with more of a cultural competency and awareness of how best to speak to communities about, for example, sexual health can be a tough topic within some communities to talk about in the open. So you might go about it in a slightly different way. You might have, for example, dinner together and be cooking together and be having more of an education kind of conversation with folks that way. And same with queer communities. We do a lot of outreach at events like more common gay bars or some of the bathhouses that we might have a queer community that are frequenting more frequently, in order to make sure that we are accessing people where they might actually need our services out in community. So we have a bit of a combination of the drop-in center space that we do community outreach, we do street-based outreach for our more vulnerable communities that we work with, and then out in the community at events as well.
And so most of this is most of it basic education and stuff. Is that how we're trying to make the biggest differences through education?
Absolutely. And I'm doing a lot of talking.
No.
Let me let Louis-Jean talk.
No, so we definitely do education, but we're also focused on testing as well. So we're going to start testing people at our drop-in center in Medicine Hat and in Calgary. So that will be publicized very soon. People can also connect with us on social media as well. So on our Instagram accounts, on LinkedIn, on Facebook, we have places where we put out educational materials for people to take and to be aware, and they can contact us there as well. Yeah.
No, that's great. Yeah, exactly. Because trying to reach people is ultimately the challenge, right? So people know what's going on. I mean, and I don't know what stats and how much you can give us, but are there a lot of people that are taking advantage of the services that you provide on a fairly regular basis?
For sure. Yeah. We have very small teams when it comes down to it. We have about a 10-person team that manages our support services in Calgary and in Medicine Hat, and they each see we only track by contacts as opposed to unique individuals, and we have at least 7,000 contacts in each city per year. So some of those are same people repetitively, but lots of diversity of folks that we're working with.
And just to add to that, just last year alone, we had about 300% surge in the demand for our services in Calgary alone. So that means we're seeing more participants on a daily basis than we did the previous year.
Okay, well, which is good, but challenging simultaneously.
Yes, because you need to increase capacity as well to respond to those needs.
Yeah.
So on the capacity side, I mean, what could Albertans do to help you guys, increase that capacity or continue to do the great work that you guys are doing?
Always, donations are gratefully accepted, of course. Financial donations are great, but also even items in person. We hand out a lot of water bottles, snacks, and hygiene items as tools of engagement. So when we're out in community, as well as doing street outreach, to be able to start that conversation with someone that maybe we haven't met before, we'll offer, a snack and water, and that's like a tool of engagement to chat. And hygiene items are just another really popular item that a lot of our more vulnerable community members will ask for. And financial donations, we love those as well. And our website is safelinkalberta.ca, and we can accept donations that way, as well as, of course, the old-fashioned ways via check, etc., and cash.
Okay, well, that's great. I mean, on behalf of Trek, we're happy to donate $2,500 to Safelink today to just help in the great work that you guys are doing. And I know that we were part of this pop-up village that just happened earlier last week, and again, trying to get out into the communities is just so important. Meet people, and there was a lot of people that attended the event, and we're trying to use the different resources that Calgary has, not just Safelink, but so many different resources that Calgary has, which continues to help the vulnerable population. So thank you for the work that you do. I think that's amazing.
Thank you so much for your support. We really appreciate
that. And just to add, you can also volunteer. So we take volunteers as well. And for those who work for companies, you can ask your company about an employee match program where you volunteer and they donate your volunteer hours in cash to us. Or if you donate to us, they could match your donation. So there are different ways. We also take legacy giving, we take annual giving, we take monthly donors as well, those who want to support us with $10 every month, $20, even $5. We take that because every dollar counts for us. So
Okay, well, that's fantastic. Thank you for the information.
Thanks.
Absolutely.